There's what's referred to as lumbopelvic rhythm. And if you didn't know you had rhythm, you do. And you're here and in here.
Well, I'm a white boy. I don't
No, you got some in here and in here. So, well, he might not, right? Or he might have lumbopelvic rhythm on the left and not on the right, or we'll find out, okay? So, what I'm going to have Mike do in just a minute is bend forward as if he's going to touch his toes. And what should happen first is, when he flexes, his spine should flex, including his sacrum. As the sacrum flexes, I wish I could disarticulate this, it's going to move forward relative to the pelvis. But not much, because there's a whole bunch of ligaments in here holding this joint together. And then as he continues forward, his pelvis should anteriorly tilt. And then as he stands back up, his pelvis should derotate, and then his sacrum should come back into neutral. Okay? So there's this timing where what we should have is spinal flexion, pelvic rotation, spinal extension. So there should be this little lag that happens. Okay? So what we should see if I put my thumbs on both PSISs and he bends forward is there should be a lag where he goes forward and then his pelvis comes up. And then when he stands back up, his pelvis should drop and then his spine should follow. What we're likely to see on Mike is, because this right SI joint is already too tight, a little too cozy, is that when he bends forward, this side is going to take off sooner than this side, prematurely, right? Because this side of his pelvis is moving in time or more in time with his sacrum. There should be a time lag between the pelvis and the sacrum, but with Mike we'll probably see his spine and sacrum start to go, the right side of the pelvis will come up, and then the left side. Okay, and then the opposite on the way back. Down. All right, you go straight up again for us. Mark you here. I'll have you do it a couple times, but let's have you just slowly start to bend forward like you're going to touch your toes. There goes the right side. Oh, there's the left. Come back up. Left drops back down. And the right doesn't come all the way down because it's already elevated. One more time. So spinal flexion, pelvic rotation, good, and come back. Pelvis derotates on the left and then on the right. Everybody see that? It's kind of 1, 2, 1, 2. So this right SI joint is hypomobile, doesn't have enough motion to it, right? There should be a little more lag before that side goes up, okay? So that's the Adams test, or the forward flexion test. The Gillette or the Stork test, we're going to look for just the opposite. When you stand on one leg, if he raises his left leg, his pelvis should posteriorly rotate. So that PSIS should drop pretty much immediately. When he stands on his right leg, the PSIS should drop immediately on the right side. The fact that this SI joint is a little stuck is probably going to show when he stands on his left leg, we'll get good motion. When he stands on his right leg, it's not going to drop as far. Okay? Alright, so let's have you go ahead and slowly, you're going to shift your weight onto your right, raise your left knee up towards your chest a little bit. There goes the PSIS, and back down, and then opposite side. It actually kind of comes up a little bit, and back down. We'll do it one more time on each side. Left leg. Get that rotation down. I have my thumbs lightly on there so I can just follow his motion. This PSIS actually goes a little laterally, right? So it doesn't drop. So his pelvis is kind of stuck.
And there's pain in the anterior hip and the flexors on the right and upper left.
Okay. We got some pain as well. So that's the Gillette or the Stork test.
And okay. You can feel that with your thumbs in there too. You can feel that movement.
Yeah, so what I'm trying to do is just rest my thumbs lightly on the PSIS and then kind of ride with that motion on one side, and then on the other side, instead of it really coming down, it came down a little bit and then it kind of went out to the side. Okay. I typically will find that the forward flexion test is a little easier to track than the Gillette, but they're both essentially testing the same thing. The other test, I'm going to have Mike lie down on his back. is the Faber test. Did I put it up there? Test is going to check for any pain or discomfort in his SI joint as I put his hip into flexion, abduction, external rotation. Does that feel alright? Okay. And then I'm going to put one hand on his knee, the other hand on his ASIS on the opposite side, and gently press down. Okay, in the SI region. Okay. Now some folks, they can't cross their legs over, so you can do any variation, like a modified tree pose, anything that recreates that position. And we'll check his other side. Flex, abduct, externally rotate. Oh, look at that to begin with. Look where his knee is. How does that feel?
It feels tight.
Okay. We're going to stabilize on his opposite ASIS. Let us know if this gives you any pain.
No pain. I just feel like a lot of tightness.
Okay.
Flexors.
So no pain, and he doesn't have an active SI joint issue going on, but we can see some residual effect from the previous SI joint issue, or some precursor to the predisposition to SI misalignment on his right side. Okay, that's the Faber test. Questions, thoughts?
So how far could you adjust that? I mean, if somebody's really having a tough time going into that full flexion and external rotation with it, I mean, could be all the way down there.
Could be down here.
Okay.
Does that create pain? I mean, unless their knees, right on the table.
Right.
Yeah. And not everybody will be able to do that test.
Mm-hmm.
Yeah. Robin.
I'm wondering if that will ever cause it to go back into alignment.
It can.
Will that adjust it potentially?
Typically what that does is it jams up the SI joint. So if it's got normal motion, if it's got the normal amount of space to it, you're just kind of playing with that normal joint space. But if it's already jammed up, you're just jamming it up even more and it'll recreate pain. So more often what would be alleviating would be, so bring here, this up, coming this way. So that's going to open that SI joint space. And a lot of times folks will get a pop or a spontaneous adjustment with this. But if they don't, think about what a chiropractor will do. They'll put you in some similar position to this and then they'll force it, right? It works sometimes. Okay. All right. So let's everybody grab